Welcome to my video about CBT therapy and techniques. Soft, gentle introduction. I did a group therapy based on cognitive behavioral therapy. It was a 12-week program, and I want to just maybe introduce you to some of the techniques that I learned, a brief introduction, and you can decide for yourself if it's something that you want to continue within therapy, or you can research more about it on your own. Cognitive behavioral therapy, CBT, is a powerful approach to mental health that focuses on identifying and changing negative thought patterns and behaviors. We'll cover such topics such as cognitive restructuring, mindfulness, relaxation techniques, problem solving, and behavioral activation. Whether you're new to CBT or looking for a refresher, I hope this video will provide a helpful overview for you to continue in your process. CBT is based on the idea that our thoughts, feelings, and behaviors are all interconnected. So, by changing our thoughts and behaviors, we can improve our overall mental well being. There are many different CBT techniques, but here are 5 of the most common and what I found the most helpful in my therapy and my journey. So, the first one is cognitive restructuring. So, this is a process of identifying and challenging any of your negative or distorted thoughts. So once you're able to identify some of these thoughts, you can start to question their validity and replace them with more positive or realistic thoughts. Some examples of cognitive restructuring are a person who is feeling anxious about an upcoming job interview might think to themselves, I'm going to mess this up. I'm not qualified for this job. So, using cognitive restructuring, they could challenge these thoughts by asking themselves questions like, what evidence do I have to support this belief? And what is the worst that could actually happen to me? They could then replace these negative thoughts with more positive and realistic ones, such as, I am a qualified candidate and I have a lot to offer this company. Example 2 is a person who is feeling depressed might think to themselves, I'm never going to be happy again. Everything is terrible. So, using cognitive restructuring, they could challenge these thoughts by asking themselves, is it really true that I will never be happy again? And what evidence do I have to support this belief? They could then replace this negative thought with a more positive and realistic one, such as, I have experienced happiness in the past. Everything is not terrible, and I can experience it again in the future. So, the second technique is mindfulness. Mindfulness is the practice of paying attention to the present moment without judgment on others or yourself. It can be helpful in reducing stress, anxiety, and depression. And there are many ways to practice mindfulness, such as meditation, yoga, and deep breathing. I actually have a few guided mindfulness meditations on my channel if you want to take a look. So, a couple examples of mindfulness are a person who is feeling anxious might practice mindfulness by focusing on their breath and body. They could close their eyes and pay attention to the sensation of their breath as it enters and leaves their body. They could also notice any physical sensations that they are experiencing, such as tension in their muscles or pain. Another example is a person who is feeling overwhelmed might practice mindfulness by focusing on their senses. They could pay attention to the sights, sounds, smells, tastes, and even textures around them. They could also notice any thoughts or feelings that are coming up for them. I use this a lot actually at work since my group therapy. And when I'm feeling overwhelmed or very stressful or anxious, I usually end up going to my car and I do some deep breathing and I look around and I verbally out loud say what I'm seeing and feeling. So that's another one. The third one is relaxation techniques. So there are several different relaxation techniques that you can use. They can help you reduce stress and promote physical and mental relaxation. So some common relaxation techniques include deep breathing, progressive muscle relaxation, and visualization. So this kind of ties into the mindfulness as well. So some relaxation techniques that I have used is deep breathing. Like I said, you inhale slowly and deeply through your nose, hold your breath for a few seconds, and then exhale slowly through your mouth. Or a person who is having trouble sleeping might practice progressive muscle relaxation. So you find a muscle group in your body, you tense it up really tense, and then you let it go. And you work your way up from usually from your toes to your head or your head to your toes. And this helps mindfully relax your body. The fourth technique is problem solving. Problem solving is a skill that can be helpful by managing stress and anxiety. It involves breaking down problems into smaller, more manageable steps and developing a plan to address them. For me, this usually involves writing down something or doing a mind map of problems. So, a couple examples of this is a person who is having trouble at work might use problem solving techniques to identify the source of a problem and come up with a plan to address it. Start by brainstorming a list of possible solutions and evaluating each one to see if it's feasible and effective. You could either even do a like pro and con type brainstorming. Another example is a person who is struggling with a relationship might use problem solving techniques to identify areas of conflict and come up with a plan to improve communication. The last one is behavioral activation. So, for this one, it's a technique that involves increasing the frequency of positive activities in your life. So, when depression tells you, lay in bed, do nothing, you do the opposite of that. You get outside, you go for a walk, you call a friend. Some other examples of this is a person who is feeling depressed might make a list of activities that they used to enjoy and start to do them again. You almost have to force yourself to do this. So it includes things like spending time with friends, listening to your favorite music, doing things that you knew you enjoyed before. Example two is a person who is feeling anxious might make a list of things that they can do to take care of themselves, such as eating healthy foods, getting enough sleep, exercising. It seems so cliche, but taking care of yourself really is an important part of mental health. Um, so then you make a conscious effort to do these things on a regular basis. For myself, I bought a journal and I track every day how many times I'm doing the things that I found important, like exercise, self care, such as doing my hair or doing my makeup. Those things make me feel good. So I hope some of these examples to illustrate some of the 5 CBT techniques might help you or encourage you to continue on your healing path. I encourage you to talk to a therapist or a counselor or delve into it further online. If you like my video, please like, subscribe, and follow me for more on my journey. Thanks a lot. Good night.